As we welcome the Honourable Minister, I would also like to request all the distinguished speakers of the session to kindly grace the dais. May I request Mr. Louis Georges Arsenault to kindly join us here on the dais. देवी सज्जनों, आप सभी से अनुरोध करना चाहूँगी कि अपना स्थान ग्रहण कर लें। धन्यवाद। माननीय मंत्री महोदय व मंच पर आसीन हमारे सभी माननीय व आदरणीय अतिथिगण और इस सभा में उपस्थित सभी गणमान्य जन, देवी सज्जनों, आप सभी का बहुत बहुत स्वागत है आज के इस शुभ अवसर पर और एक बहुत ही महत्वपूर्ण अवसर जिसमें मिशन इंद्रधनुष का मीडिया कैंपेन आज यहाँ लॉन्च किया जाएगा माननीय मंत्री जी के कर कमलों द्वारा। This, ladies and gentlemen, is a call for action by the Government of India to intensify its efforts to expedite the full immunization program in the country. संपूर्ण टीकाकरण की तरफ भारत सरकार का आज का ये अवसर एक बहुत ही महत्वपूर्ण और एक अहम कदम है। So at the outset, ladies and gentlemen, we would like to express our heartfelt thanks and extend greetings to all our distinguished dignitaries present on the dais who have been instrumental in formulating this mission and are further guiding and supporting it. सबसे पहले हम स्वागत करना चाहेंगे व धन्यवाद करना चाहेंगे माननीय केंद्रीय स्वास्थ्य और परिवार कल्याण मंत्री श्री जेपी नड्डा जी का, और मैं उनसे अनुरोध करना चाहूँगी कि इस पौधे को स्वीकार कर हम सभी यहाँ उपस्थित लोगों की शुभकामनाओं को स्वीकार करें। Presenting him this green plant, which is symbolizing the growth, the health, and sustainable growth and development. We would also like to welcome Shri Bhanu Pratap Sharma, respected Secretary, Ministry of Health and Family Welfare, Government of India. Welcoming Dr. Professor Jagdish Prasad, Director General of Health Services. स्वागत करना चाहेंगे श्री सी के मिश्रा जी का, एडिशनल सेक्रेटरी और मिशन डायरेक्टर, नेशनल हेल्थ मिशन। बहुत बहुत स्वागत और शुभकामनाएं डॉक्टर दीपक कपूर को, चेयरपर्सन रोटरी इंडिया National Polio Plus Committee. Welcoming Mr. Louis Georges Arsenault, the UNICEF representative in India. And we are just now also being joined by Dr. Nadda, the WHO representative in India. A hearty welcome to her. And may I request you, ma'am, to kindly accept this plant as greetings to you, welcoming you on the occasion. Welcoming Dr. Rakesh Kumar, Joint Secretary, RCH. And welcoming Professor Ramanan Lakshmi Narayan, the Vice President, Research and Policy, Public Health Foundation of India. और देवी सज्जनों, आइए अब सबसे पहले इस मिशन की कामयाबी के लिए इस ज्ञान और ज्योति के दीप को प्रज्वलित करते हैं। मैं अनुरोध करना चाहूँगी माननीय मंत्री जी से और मंच पर आसीन हमारे सभी माननीय अतिथिगण से भी कि इस शुभ कार्य में अपना साथ दें। Requesting all the distinguished dignitaries on the dais to kindly join us in lighting the ceremony. Ladies and gentlemen, the lamp which is being lit right now is the lamp of knowledge and wisdom. And in our true Indian tradition, in our custom, we always light the lamp, marking the auspicious beginning of our efforts. And as you can see, each wick which is being lit, it is in fact being passed from one person to another. That represents the sharing of knowledge. And that is how, in fact, you grow, you evolve by imbibing knowledge, by sharing knowledge, and the lighting of the lamp symbolizes that. The lamp being lit for the success of this mission. हमारी भारतीय परंपरा, हमारी भारतीय संस्कृति के अनुसार ईश्वर की अपार कृपा, ईश्वर की वंदना, ईश्वर की स्तुति के साथ हम इस मिशन इंद्रधनुष का स्वागत करते हैं। Thank you to the Honourable Minister and the distinguished dignitaries. और अब मैं आमंत्रित करना चाहूँगी श्री C.K. मिश्रा जी को, एडिशनल सेक्रेटरी एंड मिशन डायरेक्टर ऑफ द नेशनल हेल्थ मिशन, उन्हें आमंत्रित करना चाहूँगी उनके स्वागत भाषण के लिए।
बहुत धन्यवाद। Honorable Minister for Health, Secretary Department of Health, Shri B.P. Sharma, Director General Health Services, Dr. Jagdish Prasad, our partners in this campaign, Ms. Asna from UNICEF, Nata Matabde from WHO, Deepak Kapoor from Rotary, Mr. Ramanan, Dr. Rakesh Kumar, all our partners sitting in front, my colleagues from the ministry, friends from the media, ladies and gentlemen. It's yet another milestone in the long run-up to what we have decided to call Indradhanush. The 7 colors signifying the 7 vaccines that the children of this country are entitled to get and must get. This entire campaign is actually to ensure that the entitlement is fulfilled. And in that direction, the basic learnings that we have had from the past now forms a platform on which we will launch the mission. Partners here on the dais, in the auditorium, and some of them who are not here, joined hands together along with the frontline health workers of this country to do what was once thought undoable, and that is get rid of polio from this country. It was not just a success story, it was a huge learning from the country. And any value that learning can get is only if we are able to pick up those pieces which made it successful and use it in future. That's precisely what Mission Indradhanush intends doing. Our learnings from polio will be completely put to use in this program so that we are able to reach every child who we have either left fully uncovered or partially covered. The underlying mission being no child should be left. This does not mean that this is a parallel exercise to routine immunization, the importance of which can never be less. This will be an addition. The aim being, by the time we are 2020, we can confidently say that we are more than 90% in reaching every child. So with that aim, we've called this launch today of the media campaign because it is as essential to organize, plan and reach as to make people aware. Therefore, this media launch today, to which I welcome all of you. And the Ministry of Health is grateful to all of you for the support that you've given us for so long. And I'm sure the support will continue to get in future. So thank you very much for being here. I will just take 2 minutes to run you through to what the Mission Indradhanush will look like, or in terms of design, what it looks like. You're all aware that 1985 we started our universal immunization program. 2010 we added another antigen to it. The problem that we faced is, when we were undertaking this journey, there were about 90 lakh children who were either missed completely or partially immunized. And unless we are able to do that, we realize that we'll not get to our goal of getting 90% immunization in this country. We are growing by roughly about 1 percentage point every year. It should technically be 25 years since we do 95. But we have now come up with a program which will compress all that. It will mean a lot of hard work. But we will reach those districts in the first stage which are the worst in terms of indicators, in terms of the left out children. We have identified 201 such districts, and 82 of them, majority of them, are in 4 states in the country. 221 high focus districts, which have the largest number of partially left out children, and I may inform that when we complete the first phase, towards the end of the year, we'll be launching the second phase for 297 more districts. This, as I said, learning from polio is, if you want to succeed, build partnerships and work on that. This is another exercise where all our partners have actively come together with all the resources at their command to make it successful. So I said they are all in 4 states. To just give you a flavor of how we chose these districts, let me run through for about 10 seconds each on all the 4 states on the way we selected the district and how we gave them points which were 7 plus and below 7. So let us see UP, for example. The red that you see is high priority, which got 7 or more points, which means less than 50% of full immunization or more than 40,000 children missed in that district. So that is how we came up with this, and this will be our focus this time. Similarly, this is Bihar, where we are now doing these districts in the phase 1. 42 districts are in UP. This is Madhya Pradesh. 15 districts in Madhya Pradesh will be doing. If you see the greenish patch, that is the medium priority which will be taking up in phase 2. This is Rajasthan. Now, what is it that we are going to target? Because the routine immunization is an old program and we've been coming up with it. What we'll actually be targeting is, we know the areas where we don't have sufficient presence of health workers. So those are the areas which are going to be targeted. Because if there were no health workers, it is presumed that the children would have been left out. We will target those areas like we did in polio, which has a migrant population, which has large slums, which has brick-kiln people, construction workers, and other such people who migrate from one home to the other and are not traceable. So we will try and locate all those, work on the microplans of polio, and identify the low coverage areas and do them. How will we do it? We'll do it this way. 4 rounds of activity. 1 week each, starting the 7th of April. So we'll do 7th of April, 7th of May, June and July. 1 week where in the sessions, the ANMs will move from one village to another under their jurisdiction with a line listing of all the children who have been missed out, with all the vaccines and antigens, and ensure that then no child is left to have the vaccine that he has missed out on. This way we intend covering everyone, but we do realize that in 1 round we may still be missing some. To make sure that we reach everyone, we'll do 4 rounds. I would also like to flag that when we are doing these 4 rounds, we will make sure that the routine immunization, which is normally bi-weekly in every state, will continue with the same amount of intensity. So 7 days, as I said, that is the targeted beneficiaries, and we'll have both fixed day sessions as well as mobile sessions. Now, some of the key steps that have gone into the meticulous planning of Indradhanush are revision of the microplans, and the biggest, if you look at the whole chart of why children have been missed out, you will find that about 65 to 70% have been missed out only on account of two reasons. The first being that they were unaware of this, and the second being that they had some kind of a fear in their mind against the vaccines, which again points to lack of awareness. So this 65 to 70% missed out is only due to lack of awareness. Therefore, for any new campaign that we launch, that must form the basis. Therefore, communication and social mobilization is going to be key to the entire activity. We have done the training of all the health officials, and like always, the leadership has to come at the district. At the district level, when the district collector and the local representatives and the elected representatives take up the leadership, we will succeed in this program. And of course, concurrent monitoring, which is so basic to such designs. So this is how we intend launching our Mission Indradhanush. The good part about Mission Indradhanush is that it has support from every corner, from the political leadership, from the officers, from development partners, and civil society. And I'm sure together we will be able to make it happen this time. Thank you very much, ladies and gentlemen.
Thank you, sir, for giving us insights into the Mission Indradhanush and discussing here the mission, the scope, the approach, and the focus points and the focus states. And now, ladies and gentlemen, I would like to invite Professor Ramanan Lakshmi Narayan, the Vice President Research and Policy of the Public Health Foundation of India. Would like to request him to kindly present an overview of the Immunization Technical Support Unit.
Honorable Minister of Health and Family Welfare, Shri Nadda ji, dignitaries in the dais, friends and colleagues. India has made a lot of progress on health. In fact, since independence, life expectancy for the average boy or girl child born in this country has gone up nearly 30 years, 3 decades. Particularly in the last decade, we've made a lot of progress thanks to immunization programs and other activities, but a lot remains to be done. As Mr. C.K. Mishra just mentioned, we fall woefully short on a particular indicator, which is on routine immunization coverage, which has lagged and still increases only at about 1% per year, and we are still at about 65% per year. Now, with a view of assisting the ministry with techno-managerial support as well as organizational support to take forward the routine immunization program, about 2.5 years ago, we had reached an agreement with the Bill and Melinda Gates Foundation, with the Ministry and the Public Health Foundation of India to provide such support, which would then be an arm of the Ministry of Health and Family Welfare with the view of taking on activities at a scale such as with Mission Indradhanush. Now, these are activities that are complementary to the many other ways in which the Public Health Foundation of India engages with the ministry in non-communicable disease, tobacco control, with allied health sciences and so forth. But this is a critical area for any public health professional in the country, and I'm sure many of you see this as the most fundamental right that every child born in the country has, the right to not die in the first 5 years of life. And a large part of how we can prevent these deaths comes from routine immunization. So the Immunization Technical Support Unit, which was set up for this purpose, works in 6 programmatic areas: program monitoring and evaluation, tracking adverse events following immunization, strategic communication, bringing evidence to policy, strategic planning, and last but not least, vaccine logistics and cold chain, an area where we are constantly striving to bring the most recent technologies, information systems, and other innovations to the table to help improve how we get vaccines to every last child that really needs them. I think we say very often within PHFI that this is truly, in some senses, the delivery challenge of making sure that every village gets these vaccines, because there is no village really without a child that needs these vaccines. And there are certainly commercial products that reach all of these places, but we now have to ensure that these vaccines reach these very last locations. So it was with great delight that we were able to support this, the planning and conceptualization and the launch of Mission Indradhanush, which has had great leadership from within the Ministry of Health and Family Welfare, from the Honorable Minister and from the entire team that works with him. And we are delighted that this is now going to be an ongoing program, not just a campaign, to significantly increase routine immunization coverage in a very rapid period of time. Now, there are three elements of this which are, you're all aware of, but things that I think I should highlight in the context of what we're trying to do. I think that one of the areas in which we have all collectively perhaps fallen behind is emphasizing this need for full immunization. We've always talked about immunization, but not about the need to fully immunize every child. And this is a message which needs to reach every mother in this country with absolute clarity that just immunizing is not enough. Fully immunizing every child is really important. That's the first part. The second is, in a lot of the parts of the campaign, including what we'll see today, I think we need to recognize the centrality and importance of the ASHAs and ANMs. They are our system, our hands, eyes, and ears on the ground. And everything that we do through this program is meant to build the capacity and ability as well as the motivation of the frontline health workers to make the difference to this program. So that's a second essential element. And third, although we're here for an immunization program, I think our collective goals should really be much broader. So certainly we will save many lives due to reduced measles deaths, some through DPT and so forth. But more importantly, we will be building an incredible platform, not just for immunization for the 21st century, but broader maternal and child health and nutrition for the 21st century. And in this work, the Public Health Foundation of India and the Immunization Technical Support Unit is fully committed to supporting the Ministry of Health and Family Welfare and all of the partners in achieving that goal. Thank you very much.
Thank you, sir, for extending the mission and the vision of the Public Health Foundation of India, which is the Immunization Technical Support Unit of the Ministry of Health and Family Welfare, and how is it supporting the Mission Indradhanush. Ladies and gentlemen, as you heard, this mission has the support of various stakeholders across the value chain. The international organizations have also been supporting it. So may I now request Mr. Louis Georges Arsenault, who is the UNICEF representative in India, to kindly share his perspective on strengthening the routine immunization program in the country.
Thank you very much, Honorable Minister, Shri GP Nadda, Secretary Shri BP Sharma, Additional Secretary Shri CK Mishra, also Joint Secretary Dr. Rakesh Kumar, Principal Secretaries and Mission Directors of State, and I recognize a few of you from the States, representative from the media, and also distinguished guests. Very much welcome and namaskar. Very, very happy to be here today. This is really a privilege for us to be associated with this very important campaign. Indradhanush, in fact, will be intensifying immunization drive in 4 months to achieve, and I think the last speaker mentioned that, full immunization coverage in India and improve the life of children at the same time. It's also good to mention that it was mentioned by Additional Secretary Mishra earlier that we are going to be focusing on 201 districts where 50% of all unvaccinated and partially covered children will be actually the focus of this whole campaign. And so we, in fact, very much welcome a strategy that is supporting the most vulnerable and less privileged children. And it's something that we are going to come back to. We firmly believe that the mission offers a unique opportunity to reach out all the children, as we mentioned, in a convergent approach. And I want to mention also a few other things that the government is doing. I think it's important to congratulate the government that other things are happening, such as obviously, we've been talking about this a lot, the certification of India polio-free status of last year, February 2014, but also the tetanus immunization elimination in 32 states, and the remaining 4 states are expected to achieve this status, I believe, at the end of this month only. Also, the pentavalent vaccine implementation has been implemented right now in 20 states, and the remainder ones are expected to be also finalized by the end of this year. So these are just a few other initiatives that the government of India has undertaken, which are complementary to what we are discussing today, which we believe is quite important. Also, we need to look at how we are going also to be able to support the whole initiative. I think it's important just to remind ourselves that vaccines save life. It's easy. I think we all know this, but it is also true that vaccine prevents 2-3 million deaths a year, every year, preventable disease. And in India alone, 4 lakhs of children's lives are being saved by this. And so, for us in UNICEF, it is really a privilege to be associated in support of government with WHO and Rotary and other partners to really support this national and state in a strategic way, which will be looking at capacity building, media outreach, advocacy, cold chain and vaccine management under the umbrella of the Mission Indradhanush. So all aspects are coming together onto one. So I just want to focus a bit on a couple of details. In terms of generating the demand, maintaining the demand for vaccination, which is a challenge, often a challenge, and also the knowledge and information, we will help to create an enabling environment for routine immunization. We are going to be using traditional mass media, mid-media, as well as digital campaign through social media, including supporting mid-state and level media engagement in the states where UNICEF is present. And also the rollout of the communication campaign will also include supporting states in printing and disseminating of mass media RIC, billboards, TV spots, etc. There's been a lot going on, which is we are already doing, but pulling together with this drive. And also in terms of the polio legacy, which has been mentioned several times, which we have been discussing, we are looking at building from the polio strategy. We will be using the SMNet, which is a formidable network in the UPBR and West Bengal, where we are going to continue to involve, influence, tracking and mobilizing every single child through ground-level community mobilization and block-level coordination and developing communication monitoring tools. In addition, we will support the capacity building of social and behavioral change, communication planning at state and level and district level with special reference to routine immunization. So for us, in order to sustain the result of the quality vaccination, we will provide also what we call supportive supervision of cold chain and vaccine management, and we'll share feedback for health system strengthening. So finally, at state level, we will also participate actively in task force meeting, help the mission, the mission and implementing the monitoring system. So it's also important at the end, I just want to conclude by saying that right now, 71 of the 200 priority districts of Mission Indradhanush are also where UNICEF is already supporting call to action. So we have a presence, we have a capacity in 71 of this district, which is already there and under the call to action. And in addition, with a very strong polio SMNet presence in many of these districts and blocks. So we therefore have a solid structure in place and capacity to provide support necessary to make this mission possible. And with the key partnership which has been mentioned already, Mr. Minister, we really believe that this mission can be accomplished. We are looking forward to put everything we have together over the next 4 months to make it happen. Thank you very much.
Thank you, sir, for extending your constructive views towards making this mission more effective and how you're working with the central government and the state government towards taking this message to the people, sensitizing and creating awareness among the people. Thank you, sir, for extending that commitment. Ladies and gentlemen, one of another key stakeholder and key partner towards Mission Indradhanush is WHO. So I would like to now invite Dr. Nadda, the WHO representative in India, to kindly share her thoughts and views with us.
Honorable Minister of Health and Family Welfare, Shri Nadda, Mr. Banu Pratap Sharma, Secretary, Health and Family Welfare, Mr. C.K. Mishra, Additional Secretary and Mission Director, my fellow colleague from UNICEF, Mr. Louis George Arsenault, representatives of PHFI, Rotary International, Bill and Melinda Gates Foundation, donors, dignitaries, ladies and gentlemen. It is indeed this very single life that we want to save that has brought us here today. And every single life matters. And indeed, this is a very important initiative that the government of India has undertaken to reach those missed children. And they are not too few. We are in India having almost 9 million children. As Additional Secretary has mentioned, every 1 out of 3 children actually missed or partially vaccinated from different diseases. Now, what it turns into is 500,000 of children dying every year from those diseases that they should not be dying of. And this is happening not because there are no vaccines or there are no technologies, but because for a variety of reasons, these children are difficult to reach. By this multimedia campaign, which is being launched today, we are trying to reach families and communities to make demand for vaccination, full vaccination, really coming from the communities, from the families, from the mothers. We want to achieve increased awareness, increased demand for full immunization of all children, but we also are looking how we can best deliver the services that are of good quality, that are not going to miss any child, that are having records of every child and their location and their needs, and that those services are delivered by qualified, well-trained, committed health workers. Ladies and gentlemen, for a country such as India and for such a scale, it is a huge undertaking. So it is easy to say, but there is a lot of background work that needs to be done. And this background work is not only about training over 1 million health workers, where agencies such as WHO have been supporting the government to actually focus on those 201 districts for those priority states where this problem is the most prominent one. It is also about having good system to monitor and record and to trace every child. It is also necessary to have a good system where the action of the government can take place based on real data, which is delivered very quickly to the task forces at all levels of the government, national, subnational, district, field, every level, so that those concerned know what is happening and can do something about it. It requires commitment. It requires really taking it very close to the heart, but it also requires investing into system. That's why routine immunization is very close, of course, with the whole essence of this mission, because no government wants to have any problems resolved through the mission mode. It is always better to have a system which works. But in order to make it work, first one has to address those inequities and reach out to those who are not reached. Because inequities are very bad in many ways. They affect health, they affect so many things. We have many problems in this regard, not just in health sector, but also in education sector, in all the other sectors. But unless one does really targeted intervention to reduce, to eliminate this gap, then we will never have well-functioning routine immunization system. And talking about routine immunization, let me just say a couple of words about, indeed, the monumental achievement of India, which has been accomplished with the polio eradication and the whole certification of the Southeast Asia region last March with the polio-free, on polio-free situation. It is important because we don't have 4 years polio in India, but neighboring countries, they have polio, and therefore India is still at high risk of having polio importation. The polio endgame strategy globally critically builds on strong routine immunization systems, so that when polio is not there, routine systems of immunization can protect children, can maintain immunity while we are still trying to eliminate this virus from the world. So all the work that is done here, on one hand, builds on what polio eradication has developed in terms of infrastructure, knowledge, management capacity, but it also helps to make sure that sustaining polio-free India is achieved through strengthening of the systems by addressing those gaps that we are facing here now today. WHO will definitely be a strong supporter of this fantastic undertaking led by the government of India. We have already deployed some more than 50 of our surveillance medical officers who are working on polio into the districts which are now in high focus area. They will temporarily be there. They will be generating necessary information and ensuring that surveillance is of high quality, and this information will be then passed to the district task forces and the state level task forces. We are also going to recruit over 2,000 monitors who will be observing these vaccination campaigns and ensuring that the quality is maintained, that the coverage is high. So all the things we have been doing for polio, we will be now increasingly doing in support to success of this mission. Ladies and gentlemen, we also know that every year there is a World Immunization Week, which is about routine immunization, but this year's Routine Immunization Week is actually dedicated to eliminating gap and achieving equity, exactly what Mission Indradhanush is trying to achieve. So this is very much in line with the global efforts to save every child, not just in India, but globally. And another important, very pleasant for WHO is that the launch of this mission will happen on 7th of April, which is World Health Day. Even though the theme of 2015 World Health Day is not routine immunization, but it is a day when WHO celebrates its existence. So for us, it's very symbolic that the government is doing it along those lines where health of every child, every mother, every adult and old and young person in this country is in focus. I can't even recall how many significant initiatives government has taken over the last couple of months, because indeed the desire to make bold move and achieve big difference with massive effort is very strong in the government. WHO is thrilled to be part of this initiative. We are fully supporting it, and I once again congratulate and commend the government for this very important initiative. I wish success to everybody who is involved in this. Thank you.
Thank you, ma'am, for sharing your views and insights and the message of WHO, how it stands very committed towards saving every life, every single life matters for WHO. And they are committed and working along with the Government of India towards sensitizing people, towards achieving equity and addressing these gaps, and towards building a system which is very effective, at the same time a process which stands continuous for effectiveness and for sustainability of the mission. Ladies and gentlemen, we are all aware that India has been able to be now polio free. This was certificate was given by WHO, and a similar kind of success is expected from the Mission Indradhanush. I would like to now invite Dr. Deepak Kapoor, who is the chairperson of Rotary India National Polio Plus Committee, to kindly share his views on the success of the polio mission in the country.
Thank you, ma'am. Vigor, violet, indigo, blue, green, yellow, orange, red. The 7 colors of the rainbow appeared clearly on the horizon in a brief meeting with the Honorable Minister, Mr. Nadda. His vision of an India without diseases against which immunization is available is a challenge to all of us to turn it into reality. In these days of the World Cup, it would be fair to say that the opening partnership against polio has been hugely successful and has laid the foundation for a victory over a team consisting of 7 seemingly invincible adversaries. Against all odds, India has triumphed over polio, but the challenge remains of keeping polio at bay. The fight against polio has taught us several lessons. The knowledge gained and the practices and systems that have developed, for one. The world's largest public-private partnership between the government, WHO, UNICEF, CDC, and Rotary International that has blossomed. 3, the fact that the first ever people's movement in the field of health has emerged and has emerged victorious. All these are extremely positive signs for a possible victory over other diseases as well. In line with the Global Polio Eradication Initiative's End Game Plan, Rotary has committed to support the Indradhanush initiative through its traditional strengths of advocacy and social mobilization. Over 130,000 members of Rotary across the length and breadth of the country are committed to keeping India polio-free, and while doing so, in promoting immunization against all other vaccine-preventable diseases. We propose doing this by supporting routine immunization and Mission Indradhanush all over the country. For the record, Rotary has invested $1.3 billion of its own money in the campaign against polio and has helped raise over $6.7 billion from donor governments for this campaign. Rotarians in India are determined not to let the infrastructure developed by this record-breaking partnership in polio eradication be frittered away, and are determined to assist the government of India in its quest for an India where no child will have to suffer from a disease against which a vaccine is available.
Giving us insights into the polio eradication program, how it was a people's movement, a participatory movement, and where, yes, there was a charity. And probably the lessons from that mission can be now replicated in the Mission Indradhanush towards achieving success. Thank you so very much, sir. And now, ladies and gentlemen, would like to invite Dr. Jagdish Prasad, Director General Health Services, to kindly share his views and his valuable insights on how the immunization program can be made more effective.
Good afternoon to all. Honorable Minister of Health and Family Welfare, Shri J.P. Nadda Sahab, our Health Secretary, Shri Bhanu Pratap Sharma, Mission Director, C.K. Misra ji, Dr. Rakesh Kumar, Manager of the whole programs, Mr. Louis George, Mr. Deepak Kumar Kapoor, Dr. Nadda, WHO representative, Mr. Ramanathan, PHFI, all the media people, all the faculty, all the ladies and gentlemen, and the staff of our Ministry of Health and Family Welfare. I think it is a great pleasure that this program has been launched. Nothing to emphasize more. If you take a Cuba, country like Cuba, which is a much better the health structure than health index is better than USA, in spite of the fact that it is a developing country like things. And this has only been achieved, infant mortality, maternal mortality, everything which has been achieved is because of immunizations. There is no patient you will get there suffering from liver cirrhosis because of hepatitis B. So that's the great achievement. And you know how much money we have spent on hepatitis B. So I don't have to emphasize that how the immunization is so important to all of us. The few things only I want to tell in the this program, launching the program, and especially to Mr. Dr. Rakesh Kumar, that let us make 2 or 3 things compulsorily. That whoever coming for the antenatal checkup, the ladies must be told that your child make a slip, pamphlet to give the lady that this is your child, you must get if you want that your child should live a long life or no problem, no of the disease. So one leaflet has to be given to every woman who is pregnant. Number 1. Number 2, we have to take on the task gynecologists and pediatricians, the association of them, we have to make them understand and we have to get them involved. Because I was just talking Mishra ji and I told why you don't use polio and use all the partner, and why you are leaving the 5 years to get the 90% immunization, why we can't get in 1 year. He says we have to sustain it. That's correct, we have to sustain it, and like partner, this partner like Rotary, WHO cannot go lifelong. So ultimately the only one thing is left, that it is the education, it is the awareness, which we have to emphasize to a great extent. Until as we emphasize, which is the major gap, the education is the major gap, and every pregnant woman, if told about the coming child who has to be immunized, I don't think the pregnant woman will hesitate, and we have to take 5-10 minutes time. So we have to prepare a guideline like this, so that every pregnant woman today, we have now 2.6 crores children are born, and as per information provided to us, that only 1.06 crores is immunized in our UIP. There may be few people are immunized in the urban which we don't have records. But still there are many children are not immunized, and we are losing about 5 lakh children every year because of they are not immunized because of some disease which is totally preventable. So definitely immunization which has been done, we have to take, and all the guests who are sitting here should adopt that. Let us convince at least 1,000 or 2,000 children to take the immunization. Everyone has to take a task. The civil society has to come forward. Everyone has to come forward. This is not the only government of India which has to take forward. Every society, civil society, NGO, education, even Ministry of Education, even we should make it compulsory that any children coming for admission to the school class KG, the immunization chart has to be given. Without immunization chart, this is the compulsory in the Delhi, but I don't know how much it is compulsory all over the country. So this we have to ask the Ministry of Education that make it compulsory that any children coming to UG, KG, anything, they must have an immunization chart, and the charts has to be maintained. If they are asking the birth certificate, they must ask the immunization chart also from the children. So these are the few steps we have to take. Only then we can achieve the immunization. And I will tell Mr. Ji, who is a mission director, that let us use the polio and the polio's manpower who are provided by the Rotary, World Health Organization, UNICEF, for the complete immunization. We are making the target that we will do the missions mode in once in a month, 7 days in a month, and we will repeat it again and again. Let us, I was telling him jokingly or whatever you say, that मिश्रा जी आप जब तक यहाँ एडिशनल सेक्रेटरी हैं 100% करके जाइए, Let us do like this. Don't do in 5 years 95%. Time is very short in the life. We have to achieve as quickly as possible. I am a surgeon. I don't believe that treat by the medicine, treat by the surgery. So that should be our aim and objective. Thank you very much.
Very constructive views and suggestions and recommendations towards the effectiveness of this program, and as you mentioned, the basics has to be more towards sensitizing and creating awareness about the need for immunization among the people for the success, and thank you for the other suggestions also. और अब देवी सजना आमंत्रित करना चाहेंगे माननीय सचिव स्वास्थ्य और परिवार कल्याण मंत्रालय भारत सरकार को उनके विचारों के लिए आमंत्रित करना चाहूँगी श्री भानु प्रताप शर्मा जी को उनके संबोधन के लिए।
Honorable Minister of Health and Family Welfare, DGHS Dr. Jagdish Prasad, ASNMD Shri C.K. Mishra, Mr. Louis George Arsenault from UNICEF, Dr. Manabde from WHO, Mr. Deepak Kapoor from Rotary International, Dr. Ramanan, Dr. Shri Rakesh Kumar, representatives of development partners, media representatives, representatives of state governments, ladies and gentlemen. I extend very hearty welcome to all of you on this very important occasion of media launch. It's indeed a great challenge, to push the 65% immunization figure to 90%. The enormity of task has to be seen by the sheer number. It's not 65% and 90% perhaps does not capture that difficulty level. The number of children who are missed out every year is almost 10 million, 1 crore. I mean, it's about 9 million, close to 10 million. So 1 crore children have to be covered. And if they have been left out during the routine immunizations, there must have been some reasons for that. It's not that they have just been left out. The first reason could be that they are in such areas which are not accessible. Their habitations may be 4 kilometers, 5 kilometers away from the village, and it's difficult to walk. There may not be any road. The people will have to carry the vaccine, through the field, and give it to them. They may be living in a very riverine area. They'll have to go on boat to cover those children. They may have to go, on a hilltop. Their habitations may be very small, just 10 people. Small habitation. You go to a village, you cover the village, but you don't go to the habitation, which is 3 kilometers, 4 kilometers, 5 kilometers away from the main village. They may not be aware. That of course is also one of the reasons. Or if they are aware, they are frightened. They think that probably it will lead to some adverse effect. So you need to change their mindset. Then there may be weakness in the health system there. The people who are administering the immunization program, they may be weak. The vaccines may not be reaching there, or if the vaccine is reaching, the vaccinator is not reaching. So there can be host of reasons. It's not that it just happens by accident. There are valid reasons why they were missed out on the first round. So obviously, when you take such a task upon yourself, you have to go into great detail. You have to make a micro plan. You have to see that you have something on the ground to reach every child who was left out in the first instance. I'm very happy that kind of detailed micro plans have been prepared. As I mentioned, that lack of awareness is an extremely important reason why the immunization program is not 100% success. So there the role of media is extremely critical, and I hope that the media also would be extending their help in this campaign. So I will not repeat, because much has been said by my previous speakers, and all the facts and figures are before you. So I would only once again, congratulate that this thing has been launched, and I would it's my hope and wish that this is a great success. Thank you.
percent, taking it to 90% in the next 5 years. A challenge which is going to be addressed using various ways, processes, systems, and one of the strongest and the most effective medium which is being considered is using various communication mediums. So we have now the most awaited moment of the day, that is the launch of the media campaign of Mission Indradhanush. I would like to request the Honourable Minister to kindly launch the media campaign. संपूर्ण टीकाकरण की तरफ सबसे महत्वपूर्ण और जो सबसे अहम कदम है वह लोगों तक उसकी जानकारी पहुंचाना कि टीकाकरण के क्या फ़ायदे हो सकते हैं, टीकाकरण के कारण या के माध्यम से कैसे बच्चों को स्वस्थ जीवन मिल सकता है। टीवी और रेडियो और साथ साथ पोस्टर्स, होर्डिंग्स, बैनर्स एक बहुत ही सशक्त और सक्षम माध्यम हो सकते हैं लोगों तक इस जानकारी को ले जाने की तरफ। ये मिशन कैंपेन माननीय मंत्री जी द्वारा यहाँ पर लॉन्च किया जा रहा है और साथ साथ इस संदेश को बहुत ही सुंदर रूप में सुर और ताल से सुसज्जित कर लोगों तक पहुंचाया जाएगा एक गीत के माध्यम से। इस गीत को कंपोज किया है मशहूर गीतकार जावेद अख्तर ने और इसे आवाज़ दी है सोनू निगम और अलका याग्निक ने। So we would now like to present this communication material, which is sequenced as you're going to be seeing this video on your screen. It has the radio spot, followed by the various banners and posters, followed by a TV spot, and then the song which has been composed by Javed Akhtar.
बच्चे का एक सपना होता है।
मेरा सपना हवा में उड़ना।
मुझे आसमान को छूना है।
मैं लाऊंगा तारों को जमीन पर।
हर बच्चे का हक है एक ऐसी जिंदगी जीना जहां सपने सच हो सके और इसके लिए चाहिए अच्छा स्वास्थ्य जिसकी शुरुआत संपूर्ण टीकाकरण से होती है जो देता है कई जानलेवा बीमारियों से जिंदगी भर की सुरक्षा।
मिशन इंद्रधनुष स्वास्थ्य एवं परिवार कल्याण मंत्रालय भारत सरकार की पहल। 2 साल तक के बच्चों का संपूर्ण टीकाकरण जरूर करवाएं और जीवन भर सुरक्षा का वादा निभाएं।
मिशन इंद्रधनुष,
जिंदगी इंद्रधनुष बनाए।
अधिक जानकारी के लिए अपने नजदीकी स्वास्थ्य केंद्र या ANM या आशा बहन जी से संपर्क करें।
किसी की नजर ना लगे।
अब बेबी को किसी की नजर नहीं लगेगी।
मेरा प्यारा बच्चा।
बुरी नजर से बचाने के लिए इतना कुछ। सबसे पहले इसे बीमारियों की नजर से तो बचाइए।
वो कैसे?
संपूर्ण टीकाकरण से। ये बच्चे को कई जानलेवा बीमारियों से जिंदगी भर बचाएगा। 2 साल तक के बच्चों का संपूर्ण टीकाकरण जरूर कराएं।
मिशन इंद्रधनुष।
जिंदगी इंद्रधनुष बनाए।
हमारी गुड़िया को अब लगा है असली टीका।
स्वस्थ जीवन जो बच्चों को मिल जाएंगे, फूल खिल जाएंगे।
और ये सुंदर गीत यकीनन ये तारे अब ज़मीं पर भी टिमटिमाएंगे और ये नन्ही गलियां और अधिक मुस्कराएंगी। और अब मैं आमंत्रित करना चाहूँगी श्री C.K. मिश्रा जी को एक विशेष संदेश के लिए।
When we began this morning, we spoke about the fact that any mission, any program succeeds when it gets effective leadership. We in the ministry have been working constantly under the guidance of the Honourable Minister. Under his guidance and leadership, we've launched this program. Mission Indradhanush is privileged today that it has the leadership and guidance from none other than the Honourable Prime Minister of India, who has decided to lead this campaign, and he has sent a message to this gathering this morning, and I would, with the permission of the Honourable Minister, request the Secretary, Department of Health and Family Welfare, Mr. B.P. Sharma, to kindly come and read out the message of the Honourable Prime Minister.
संदेश। मुझे यह जानकर प्रसन्नता है कि देश के सभी बच्चों को 7 जानलेवा बीमारियों के खतरे से मुक्त करने के लिए स्वास्थ्य एवं परिवार कल्याण मंत्रालय की ओर से एक राष्ट्रव्यापी अभियान मिशन इंद्रधनुष का आरंभ हो रहा है। हमें एक ऐसे भविष्य के सपने को साकार करना है जिसमें हम सुनिश्चित करेंगे कि भारत में प्रत्येक बच्चे का संपूर्ण टीकाकरण हो और कोई भी शिशु 7 टीकों से वंचित न रहे। मिशन इंद्रधनुष को पूरी तरह सफल बनाने के लिए नौनिहाल बच्चों के माता पिता और अभिभावकों से मेरा आग्रह है कि अपने बच्चों को 7 टीके अवश्य लगवाएं। स्वास्थ्य मंत्रालय और राष्ट्रीय स्वास्थ्य मिशन को मैं धन्यवाद देता हूं कि आप सभी ने देश में स्वस्थ बचपन और सभी के लिए स्वास्थ्य के लक्ष्य की प्राप्ति के लिए महत्वपूर्ण जिम्मेदारी ली है। मुझे आपकी असीम क्षमता पर पूरा भरोसा है। मिशन इंद्रधनुष की सफलता के लिए बहुत बहुत शुभकामनाएं। श्री नरेंद्र मोदी, नई दिल्ली, 22 मार्च 2015।
Thank you, sir. And now, ladies and gentlemen, inviting the guidance of the Honourable Minister, requesting and inviting the Honourable Minister, Shri Jagat Prakash Nadda ji, the Honourable Union Minister of Health and Family Welfare, Government of India, for his keynote address.
आज के इस मिशन इंद्रधनुष के मीडिया लॉन्च में उपस्थित हमारे साथ भारत सरकार में स्वास्थ्य सचिव श्री बीपी शर्मा जी, हमारे डायरेक्टर जनरल हेल्थ सर्विसेज जगदीश प्रसाद जी, मिशन डायरेक्टर श्री C.K. मिश्रा जी, यूनिसेफ के हेड श्री लुइस जॉर्ज, WHO के कंट्री हेड मैडम नाडा मनमादे, हमारे रोटरी रिप्रेजेंटेटिव दीपक कपूर, PHFI के डॉक्टर रमनन, जॉइंट सेक्रेटरी राकेश कुमार, यहाँ उपस्थित हमारे डेवलपमेंट पार्टनर्स और डेवलपमेंट पार्टनर्स के रिप्रेजेंटेटिव्स, हमारे आज के इस कार्यक्रम के विशेष मेहमान आमंत्रित सदस्य, मीडिया के सभी सदस्यगण, क्योंकि ये मीडिया लॉन्च हो रहा है, और हमारे हेल्थ सेक्टर में काम करने वाले सभी वरिष्ठ सज्जन वृंद. Certainly it's a very historic occasion when we are taking a very ambitious program, and this program का जो सक्सेस है वो हम सब के एक साथ मिल करके इस मिशन को पूरा करने में जब हम जुटेंगे तभी इसकी सफलता होगी. आज अभी स्वास्थ्य सचिव सेक्रेटरी हेल्थ ने आदरणीय प्रधानमंत्री जी का संदेश पढ़ा. संदेश में स्वास्थ्य विभाग और समाज से आशा की गई है, और स्वास्थ्य विभाग पर बहुत बड़ी जिम्मेवारी का बोध भी उन्होंने कराया है, और साथ ही साथ यह आशा की है कि हम इस कार्यक्रम को समाज को साथ लेकर के सफल करेंगे. मैं आपके माध्यम से और इस मंच से आदरणीय प्रधानमंत्री जी को ये विश्वास दिलाना चाहता हूँ कि हम सब लोग अपने डेवलपमेंट पार्टनर्स के साथ और समाज के सभी लोगों के साथ, और विशेष करके बच्चों के माँ बाप को उनके साथ सहयोग करते हुए इस कार्यक्रम को एक ऐतिहासिक कार्यक्रम बनाएंगे और इसकी सफलता दिलाएंगे, इस बात का विश्वास करेंगे. You know, when I took over as the Minister of Health and Family Welfare, and I started taking the presentations on various aspects, I thought that public health is one of the most important factors, and it has to be taken very seriously. Keeping that factor in mind, I went through the statistics, and I came to know that approximately we have a routine immunization of 65%, 35 are left. This means that approximately, as the Secretary Health was saying, that 1 crore or 10 million people are left. Exact statistics say that approximately 89 lakhs people are partially covered or uncovered. 70 are partially covered and approximately 20 are uncovered. Now, if we think of Swasth Bharat, if we think of Swachh Bharat, if we think of Sundar Bharat, we can't have so long as we do not have healthy children. And healthy children is one of the very important basic need, requirement. A healthy children can only have a healthy nation. Keeping that factor in mind, we thought of taking this on a priority basis. On the birthday of our Bharat Ratna Shri Atal Bihari Vajpayee, 25th December, we thought of launching it. We came out with that plan. And we started planning it in such a manner that with all logistics we should launch it. I must thank the development partners, UNICEF, Rotary, WHO, who have worked very intensively with our department. And now we are with a very pragmatic approach. We have developed a strategy which now we can say that it is achievable. So I must thank my development partners for the hard work which they have done. When we talk of campaign mode, why do we talk of a campaign mode? Mission. Because we came to know that the routine immunization is on an increase of annually 1%. That is, if we go annually immunization process is on an increase by just 1%, how are we going to fill up this 35% gap? So we need a special attention to be taken into consideration. And for that very factor, we thought of taking it in mission mode. If we are able to, in every session, in every program, if we are able to increase ourselves by 4 to 5%, then only by the end of 2020 we'll be able to reach somewhere 90 plus. So we took a step, and you see, after the successful program of pulse polio immunization, which Madam Nadda was talking about, after the successful and getting certification last March, that has really enthused us that we can do it. It is achievable. And the experiences which we gained, we and our development partners, we have tried to take into consideration while planning and while implementing this Mission Indradhanush. This doesn't mean that it is flawless. There is no scope of flaw. We keep on understanding by our own experiences. And when we say of a media launch, I need the support of the media and input from media. Where we are lacking, what are the gaps to be fulfilled? So all that, after keeping into consideration, we have come. And now we want to see to it that this 35% of gap has to be fulfilled. We have to go in a mission mode. Every session, every phase, we should at least cover up 4 to 5%. When we talk and when we had discussions with development partners, we have tried to plug these gaps. We have tried to work very in detail about the cold chain management. Very important aspect of this campaign. The effectivity of the vaccine should be there. The quality of the vaccine should be there. The management of resources should be there. Where the vaccine is there, the health worker should be also there. There has been a gap when the vaccine is there, the health worker is not there. When the health worker is there, the vaccine is not there. And when both of them, the children is not there, the child is not there. फिर उसमें कहा जाता है कि हमें तो पता ही नहीं था कि आज के दिन वैक्सीनेशन होना है. Now you see, India is such a vast country, remote areas, moving population. It's a huge challenge. And for that we have to go into the minute details, and that details has been worked out. Today I am happy and confident to say that we have worked out all those details, seen to it that the cold chain management should work, the human resources should work, and the people and the children should be there for vaccination. But still, we have to have, it is only possible when we get the total cooperation of the society. जब एक माहौल बनता है, 7 तारीख का मतलब इम्यूनाइजेशन डे, 7 तारीख का मतलब हमको जाना है, हमको आज इम्यूनाइजेशन करानी है. तो ये एस्पेक्ट्स हैं जिसके बारे में हम लोगों ने ध्यान में दिया, और इसके लिए हम लोगों ने माइक्रो लेवल की स्ट्रैटेजी. अब when we talk, I am talking here as Government of India representative, but if we don't take states on board, if we don't involve the state secretaries, if we don't involve the state workers, if we don't involve the political leadership of the states, the results are not going to be. इसलिए हमने पर्सनली इस बात की चिंता की. मैंने चीफ मिनिस्टर से बातचीत की, मैंने हेल्थ मिनिस्टर से बातचीत की, मैंने हेल्थ सेक्रेटरीज के साथ मुलाकात की, आगे उसके उनके साथ डिटेल वर्कशॉप की, और आगे आने वाले दिनों में ये कंटिन्यूअस रेगुलर वर्कशॉप का कार्यक्रम चलेगा. फॉलोअप्स का भी an arrangement has been done that after every session there should be a follow-up. Follow-up in the sense that where we missed, where our A&M missed, where we have to go again, try again, you'll succeed at last. So we are going to keep on trying. So that follow-up aspect has been also taken into consideration. You see, I also experienced that Health Ministry does a very good job. But somewhere there has been a disconnect between the people's representative and the ministry which is working. So a special drive has been taken. We organized a workshop for the members' parliament, although we were not successful because on that very day it was a budget day and it kept on going on for a pretty long time. So we were not able to communicate to them in the right perspectives, but there was a very sincere effort from the health ministry to involve the member parliament. I assured them in the parliament, I said, that our health workers, our health representatives, our health secretaries are going to involve you in this program. And now personally we are giving them the brochure, the details, the focus districts, where they have to go, how they are to be involved. That is what we are trying to do. But I would request that we should also see to it that the MLAs are also involved. So this program needs public representative participants, and we think that we will be getting it, and your support, by your support, because मैं कई बार देखता हूँ कि public representative को is a very, very vital instrument in translating things in the society. But it is not being used. And we leave them, we don't equip them with the arguments, with the strategies, with the statistics. कई बार मुझे बहुत दुख होता है कि जो हम जैसे लोग जो दिन में 5 बार 5 बड़ी बड़ी सभा और छोटी सभाओं को संबोधित करते हैं और 5000 लोगों से मिलते हैं, उनको बताया नहीं जाता है कि क्या कार्यक्रम हो रहा है. अगर उनको बताया जाए तो कितना इंपॉर्टेंट इंस्ट्रूमेंट हो सकते हैं चीजों को ट्रांसलेट करने में. इसलिए मिनिस्ट्री ऑफ हेल्थ ने ये एक स्पेशल एफर्ट और ड्राइव ली है that we are going to organize workshops of member parliaments and member of the legislative assembly to see to it that this mission goes as a success. हमारा उद्देश्य क्या है? हमारा उद्देश्य है कि लाइफ प्रिवेंटेबल वैक्सीन जिसके वैक्सीन हो, वो प्रिवेंटेबल डिजीज हो, उसका उस ऐसी बीमारी से कोई बच्चा शिकार नहीं होना चाहिए. और इसको इस मिशन को पूरा करने के लिए our second mission is that every mother should have a safe delivery and should have a healthy child. अगर ये दोनों हमारी कमिटमेंट्स हैं तो हमको मिशन मोड में चलना पड़ेगा, और इसको हम मिशन मोड में चल करके इसको हम पूरा करने का प्रयास करेंगे. दिस इज व्हाट आई वुड लाइक टू से. एक बात और मैं जरूर कहना चाहूंगा कि वी टॉक अबाउट यंग पॉपुलेशन, दिस इज अवर डिविडेंड. अब यंग पॉपुलेशन डिविडेंड तब है जब यंग पॉपुलेशन हेल्दी है, अगर उस कॉन्ट्रीब्यूटरी है, अगर वो हेल्थ अच्छा है उसका, तभी. व्हेन वी टॉक अबाउट हेल्थ यंग इंडिया, व्हेन वी टॉक अबाउट young is our asset, it is going to remain asset only if we have it as a healthy children, as a healthy young India. और healthy young India के लिए ये आज हमको ये मेहनत करनी ही पड़ेगी, इसको पूरा करना ही पड़ेगा, और इसके लिए आप सब लोगों का सहयोग की ज़रूरत होगी. जब हम मीडिया लॉन्च की बात करते हैं तो वन मोर मेजर रिस्पॉन्सिबिलिटी में जो मीडिया की तरफ आती है वो ये आती है कि जब हम लोगों की ये जो स्टडीज़ हुई हैं उसमें से ध्यान में आता है कि 40% of the children who are unimmunized, it is due to their mothers don't have the information. अभाव, जानकारी के अभाव के कारण 40% बच्चों को जानकारी के अभाव में उनको वो टीकाकरण से वंचित रह जाते हैं. और उसी तरीके से 32% ऐसे हैं जो माताएं घबरा जाती हैं, डर जाती हैं. 32% आउट ऑफ द लेफ्ट आउट्स. वो क्या है कि एक बच्चे को टीका पड़ता है, उसके बाद कई बार बुखार आ जाता है थोड़े एक आध दिन के लिए, तो माताएं घबरा जाती हैं और उसके बाद वो जाना छोड़ देती हैं. अब इस पर कहीं ना कहीं लेख, डिस्कशन, चर्चा, इसकी आवश्यकता है. जब ये हर तरीके से डिसेमिनेट होगा इंफॉर्मेशन और ये समाज में जानकारी आएगी कि 40% वी डोंट, अब ये स्टैटिस्टिक्स बता रही हैं कि 40% को ये पता ही नहीं चलता है, तो हमको बताना पड़ेगा कि 7 से लेकर 14 तारीख तक हर महीने में वैक्सीनेशन का स्पेशल प्रोग्राम चल रहा है. एक बार नहीं, अनेकों बार बताना पड़ेगा, तब जाकर के यह गूंज कहीं वहां तक सुनाई देगी. अब you just imagine we are talking here in Habitat Center and we have to vaccinate a child of a kiln worker, a child जो representing nomadic tribe, आज यहाँ कल वहाँ. अब इतनी बड़े गैप में इसको कवर करने के लिए हमको कैसी स्ट्रेटजी अडॉप्ट करनी पड़ेगी, इसका हमको कल्पना करनी चाहिए. वी हैव टू विजुअलाइज, कंसेप्चुअलाइज दैट व्हाट टाइप ऑफ प्लानिंग डू वी नीड टू रीच दीज पीपल. एजुकेशन को ध्यान में रखते हुए, बाकी सारी चीज़ों को ध्यान में रखते हुए, उनके सोशल बैकग्राउंड को ध्यान में रखते हुए. इट्स ए ह्यूज टास्क और इसमें आप सबकी मदद की ज़रूरत है, मीडिया की विशेष करके ज़रूरत है. एक मैं और कहना चाहूँगा, आई डोंट नो, लेकिन जब हम चर्चा करते हैं तो हेल्थ इज नॉट एन इंडिविजुअल सब्जेक्ट, इट्स अ कॉम्प्लेक्स, इट्स इंटरसेक्टोरल एस्पेक्ट्स आर रिलेटेड टू इट. पानी खराब होगा तो वाटरबोर्न डिजीज होंगे ही होंगे. एनवायरनमेंट खराब होगा तो उसकी समस्याएं आएंगी. कहीं वाटर में आर्सेनिक होगा, फ्लोरोसिस होगा, तो उसके एस्पेक्ट्स हमारे हेल्थ के उसको प्रभावित करेंगे ही करेंगे. इसलिए हमारी कोशिश है, हमने ये कोशिश की है कि हमारा इंटरसेक्टोरल कन्वर्जेंस स्ट्रेंथन हो. लेकिन इंटरसेक्टोरल कन्वर्जेंस तब स्ट्रेंथन होगा जब सोसाइटी में भी, इन सोसाइटी वी आर एबल टू educate, no, I will not use the word educate, but enunciate and explicitly tell that intersectoral other departments को भी साथ लेकर के जब हम इसको आगे बढ़ेंगे, then only success will come. अब जापानीज इंसेफ्लाइटिस होता है, एक्यूट इंसेफ्लाइटिस होता है. मैं गया हूँ, उन एरियाज को विजिट किया है. जिस तरीके का वहाँ एनवायरमेंटल प्रॉब्लम्स हैं, उसके बीच में ये जेई और एएस को हम उसकी क्योर तो कर सकते हैं, लेकिन और उसको हम मेडिकेशंस तो दे सकते हैं, लेकिन प्रिवेंट तो तभी होगा जब हम एनवायरनमेंट को क्लीन करेंगे. एंड द नंबर्स आर गोइंग टू डिक्रीज ओनली देन. तो इसलिए हमको एक इंटरसेक्टोरल कन्वर्जेंस की तरफ ध्यान देने की जरूरत है और उसमें मीडिया का और समाज के सभी वर्गों का सकल सहयोग, पॉजिटिव कंट्रीब्यूशन की ज़रूरत है. ऐसा मैं निवेदन करना चाहता हूं. आप सबका मुझे इसमें सहयोग मिलेगा. मीडिया एक बहुत महत्वपूर्ण समाज में परिवर्तन लाने का उपकरण है. टू ब्रिंग अ चेंज, मीडिया इज अ वेरी पावरफुल इंस्ट्रूमेंट. I don't say that we are able to communicate to the media in the right perspective. We are not champions of that. लेकिन हमारी थोड़ी भूल हो तो उसको भूल समझकर, intention is very clear. Intention is to reach to the person, to the children last who is devoid of it. और इसमें आपका सहयोग चाहिए. मुझे पूरा विश्वास है कि मीडिया का इसमें हमको सहयोग मिलेगा, समाज के सभी वर्गों का सहयोग मिलेगा. डेवलपमेंट पार्टनर्स के साथ एक बहुत ही अच्छे इंटेंशन के साथ, अच्छे मन के साथ एक जैसे कहते हैं कि एक महत्वाकांक्षी योजना, और योजना के साथ साथ, योजना नहीं कहूँगा इसको, मैं मिशन कहूँगा, इस मिशन को लेकर के हम, इस संकल्प को लेकर के हम चलने का प्रयास कर रहे हैं. आप सबका सहयोग मिलेगा ऐसा विश्वास है और हम इसमें सफल होंगे. समय समय पर मिलकर के अपनी गलतियों में और सुधार करते चले जाएंगे. वी विल मेक इट अ कंटिन्यूअस प्रोसेस of interacting with each other so that we strategize in the best possible manner and our systems get improved day by day and we reach to the needy, to the person who needs our help. That is what I can say. Thank you very much. बहुत बहुत धन्यवाद.